Hello guys, welcome to my YouTube channel Rapid Made. Let's start our topic without any further ado.
Our topic is cellular injury. Let's start it. It occurs when there is a stress and it exceeds cell ability to adapt. It depends on the type of stress, its severity, and the type of cell affected. So, by the cell type, I mean if it's neuron, then there is increased susceptibility to ischemic injury. If it is skeletal muscle, then it is relatively more resistant. If slowly developing ischemia, like in renal artery stenosis, it results in atrophy, whereas in acute ischemia, like in renal artery embolus, injury occur. The common causes of cellular injury include inflammation, nutritional deficiency or access to, and hypoxia, trauma, and genetic mutation. Let's discuss a bit about hypoxia. What is mean by hypoxia? It means there is low oxygen delivery to tissue. It is an important cause of cellular injury, as I have already told about. And oxygen is the final electron acceptor in electron transport chain of oxidative phosphorylation. So oxygen is needed in electron transport chain. But if there is lack of oxygen, then there is decrease in oxygen. And if there is decrease in oxygen, then it impairs the oxidative phosphorylation, due to which there is decreased ATP. And due to lack of ATP, it leads to cellular injury. I will talk more about it later in this very topic. Okay. Now let's see the causes of hypoxia. It includes ischemia, hypoxemia, decreased oxygen carrying capacity of blood. These all are different. And let's talk about what is ischemia. Ischemia is decreased blood flow through an organ. Ischemia is decreased blood flow. Okay. Ischemia is decreased blood flow in organ. It can be either due to decreased arterial perfusion, or can be due to decreased venous drainage, or it can also caused by shock. And if I have to give one example of decreased arterial perfusion, then it's atherosclerosis. And if I have to give one example of venous drainage, then it's Bort-Chiari syndrome. What do you mean by Bort-Chiari syndrome? In Bort-Chiari syndrome, there is thrombosis of hepatic vein. Okay. Now let's talk about hypoxemia. Hypoxemia is a low partial pressure of oxygen in blood. Okay, it is a low partial pressure of oxygen in blood, and that is about partial pressure of oxygen less than 60 millimeter of mercury. And it occur in high altitude, hypoventilation, interstitial pulmonary fibrosis. We can also say it is in a diffusion defect, because there is defect of diffusion from alveoli to blood. Okay, because there is very thick diffusion barrier in interstitial pulmonary fibrosis. And another example is ventilation perfusion mismatch. Blood bypass oxygenated lung or oxygenated air cannot reach blood. And the examples of mismatched ventilation perfusion ratio can be, I have already told you, either due to circulatory problem like right to left shunt, or ventilation problem like atelectasis. In these two conditions, there is ventilation perfusion mismatch. There are other examples too. And the another causes of hypoxia is decreased oxygen carrying capacity. Okay, it arises with hemoglobin loss or dysfunction. Examples are anemia, because there is decrease in RBC mass and partial pressure of oxygen is normal, but in anemia there is partial pressure of oxygen is normal and saturation of oxygen is also normal. In carbon monoxide poisoning, also there is decreased oxygen carrying capacity. Okay, and in it the cherry red appearance of skin is seen. Cherry red appearance of skin is the classic finding of carbon monoxide poisoning, because carbon monoxide bind to hemoglobin more avidly than oxygen. So there is also normal partial pressure of oxygen, but saturation of oxygen is decreased in this case. But in anemia it's normal. Okay, in anemia it's normal, but in carbon monoxide it is decreased. And classic finding is, as I have already told, is cherry red appearance of skin. And the early sign of exposure is headache. It's headache. In carbon monoxide poisoning, the early sign is headache, and its significant exposure leads to coma and death too. Now let's talk about methemoglobin. What is methemoglobin? it is iron in heme. Iron in heme is oxidized to Fe3 plus. Fe3 plus, not Fe2. Fe2 plus is normal, but it is oxidized to Fe3 plus, which cannot bind oxygen. Fe3 plus cannot bind to oxygen. So in it, partial pressure of oxygen is normal in it. Also partial pressure of oxygen is normal, but saturation of oxygen is decreased in this case too. Saturation of oxygen is decreased in hemoglobin and carbon monoxide poisoning, but normal in anemia. Okay, remember these lines. And the classic finding of cyanosis is chocolate color. In this case, cyanosis occur, and the classic finding of cyanosis is chocolate color blood. Okay. Then, if we have to treat it, what is the medication? We will give intravenous methylene blue. Okay, it helps to reduce Fe3 plus back to Fe2 plus state. Fe3 plus to back to Fe2 plus state, which again helps in binding with oxygen and increase the saturation of oxygen. Now let's go to reversible and irreversible cellular injury. Hypoxemia impair oxidative phosphorylation resulting in decreased ATP, as I have already told you earlier. In low ATP, if there is low ATP, it disturbs the cellular function. Okay, like the sodium potassium pump in the cell membrane disrupt, and calcium pump also disrupt. And what does it result into? If sodium potassium pump disrupt, then it result in sodium and water build up in the cell. Okay, sodium and water build up in the cell, due to which cellular swelling occur. Okay, now if there is calcium pump disrupt, then it result in calcium build up in the cytosol of the cell. Calcium also build up in the cell, and sodium and water also build up in the cell if these pumps are damaged. And aerobic glycolysis change into anaerobic glycolysis. If there is anaerobic, then there is lactic acid build up, which result in low pH. Okay, lactic acid build up which result in low pH, which denaturate the proteins and precipitate DNA. And due to it, the cellular injury occur. In initial phase, it is reversible. The hallmark feature of reversible cell injury is cellular swelling. The hallmark feature of reversible injury is cellular swelling. Remember it, it's very important, guys. In cellular swelling, it results in loss of microvilli and membrane bleeding. If we saw through microscope, we can also see membrane bleeding. And it is the character of cellular swelling. Okay. And there is also swelling of rough endoplasmic reticulum, which result in dissociation of ribosome and decreased protein synthesis. And if the cell injury persists, then if it is significant, then irreversible injury take place. And what is the hallmark feature of irreversible injury? Is membrane damage. If we have to tell only one feature, which is the hallmark of irreversible injury, then it's membrane damage. And if there is cytoplasm membrane damage, results in cytosolic enzyme leaking into the serum. Okay, like if we have to give one example, then it is troponin, cardiac troponin. When does it release? It is a marker. It releases in MI, myocardial infarction, heart attack. Okay, and there is calcium buildup in the cell, because calcium enter from extracellular fluid to intercellular fluid. And if there is mitochondrial membrane damage, it result in loss of electron transport chain, because electron transport chain occur in inner mitochondrial membrane, because electron transport chain occur in inner mitochondrial membrane. And there is also leakage of cytochrome C into the cytosol, and it activates the cascade, which causes apoptosis. So it activates the apoptosis. I have already told about the apoptosis in the previous table, and I am going to describe it more detailedly in the next chapter, cell death. And if there is damage of lysosome membrane damage, then there is leakage of highlighting enzyme, which leak into the cytosol, which in turn are activated by the high intracellular calcium. So it also degrades the cellular components. So the end result of the irreversible injury is cell death. It is the final stage of cellular injury. For updated video, please like, share, subscribe and comment on my channel. Thank you.